And now I wanted to pose to you all of you a question that came in from our audience about what does the new normal look like? I think we've touched on it from each of you a little bit, but I'd love to run down the line here and get your view of what it'll look like when the country does reopen, because I think we all understand and appreciate that it won't be business as usual. Rochelle, let's start with you.
Right. Some of this is not technology. Some of this new normal is really the blunt tools that we have for mitigation strategies. I think all of our tomorrows until we have a vaccine will be in masks. I think we will be further apart. I think we will be doing more telehealth, which has been an extraordinary success, I would say, of this pandemic. I think we will be doing more working from home. People have demonstrated that that has worked. And then I think we will be leveraging the technology, as has been discussed for the last hour, to figure out how we can do some more monitoring and tracking. I would love to see more tests going on. I would love to see them out of the medical centers. But I do think, and I think everybody's going to be attesting that they're asymptomatic before they show up to any venue for the near future.
Great. Paul?
I think we're going to be having to figure out solutions to some of the challenges that are absolutely unavoidable. We know that congregate living situations, whether it's senior care situations, prisons, even colleges where people are together and really in most ways are going to have to be together physically near one another for the foreseeable future. We're going to have to figure out how to deliver care and how to operate those environments safely. I think we're also going to have to deal with the unavoidable challenges that will come from other threats that will happen during the time of COVID. And so there are going to be tornadoes this summer. There always are. There are going to be hurricanes, and those always force people into shelters, force people into situations where they're going to have to be near one another. So we're going to have to figure out these new rules that apply when we can't avoid having people in congregate settings, but we're going to have to figure out how to do it safely.
And David.
So I just want to point out that the epidemic is really highlighting issues of inequity and inequality. We're seeing, aside from nursing homes, that the highest settings for transmission and disease are in poor communities. We're going to have huge issues around equity of global access once we have an effective vaccine. And so how we respond to these issues, I think, is going to really define the COVID era.
And Stephane.
Yes, I think the biggest impact is going to be on just how we live together and how we work. I mean, if you think about the company, as one example, we are planning to keep everybody who can work from home to stay working from home to reduce density for colleagues that have to be in the labs, to be in the factory. I think it's going to be a big change. I'm hoping that some of the treatments will help reduce the fatality rate, which I feel will change a lot how people are already scared today. It's going to have a massive impact on travel, how we work. You know, we've realized, I think, through this period that we can do actually much more on Zoom than we thought we could before. So I think there's going to be a big change in the workplace, just how we work together.